Hi everybody, my name is Camilla and I'm the registered dietitian here at North Central.
And I'm David. I'm the nurse in the diabetes program.
And we are both educators in the Diabetes Self-Management Education and Support Program, our DSMES program.
And today we're going to demonstrate for your benefit how to use a glucometer to check your blood sugars.
Wash your hands with soap and warm water. It's important to remove any sugars and other impurities that can affect the accuracy of blood sugar results. Warm water helps improve capillary blood flow, making it easier to get a specimen for testing. Dry your hands with a clean and dry towel. Allow hands to completely air dry before attempting to obtain a blood sample for testing.
So it's important to have your supplies already laid out in advance. And if you ever forget, you'll know what I mean. But we have the alcohol pad. Even though you've washed your hands, it's important to use that. You need something to blot the blood because there will be a little bit of excess blood, and possibly a Band-Aid. And so then you have the glucometer. You want to look for the expiration date on your bottle of strips. Make sure they're still fresh and within the acceptable use date. Check the expiration date. This is for 2022 November 30, so we're still within the expiration date and they're still good. So then you want to make sure that the bottle is closed when you get to it. Otherwise, if they get damp in between use, they will go bad on you and won't give you accurate results. You pick out one strip with your clean hands and make sure the bottle clicks closed securely. Usually on most strips there's an indicator of what's right side up and what's upside down. In this case, this brand, you put the gold side up and you place it into the machine or the glucometer, and it instantly, within a few seconds, brings up a flashing dot that represents a blood dot or a blood drop, and that means that you've put the strip in correctly. If you put it in upside down, it won't do anything. It doesn't start it up. It's not going to work for you. So even if it's in a dimly lit area and it doesn't come on, you know you have to turn that strip over. So I'm based on experience and what works best for me and most patients. You would pick just to the side a little bit and towards the end, but not all the way on the very end. And so this is where I'm going. You press down firmly and you're pushing blood towards the tip of your finger so that you've got it nice and red, and you push down. You hear the click, you just gently squeeze a little bit more. In explaining this, the glucometer quit being effective and ready for use, so I put the strip back in again. And now you just, once you make sure it's ready to use, you take it and you gently bring the blood, by touching the blood drop onto the, and there you get a result. Now I'm diabetic, so that blood sugar is a little bit higher than I want it to be, but it's okay for now. And that result is one that you need to monitor and report to your doctor regularly by keeping records. And your doctor is the one who determines what is acceptable and what's not acceptable. So it's not for me to say, it's for your doctor to say. Right now it's 1:32. I'm going to remove this strip. I'm still holding some pressure on my finger to make sure that I've stopped any bleeding potential, and it looks like it's dried up pretty well. And so I have this leftover alcohol wipe. I'm just going to go ahead and clean it the rest of the way. Make sure it doesn't start bleeding again. If it does, you just need to hold more pressure for a little bit longer.
And that's how you check your blood sugars using a glucometer. Remember that it's important that every time you check your blood sugars, you record the results on a logbook and bring your logbook and glucometer to every visit. We'll see you next time, guys.